name's Laura, and I'm doing an intradermal injection and then a SubQ taking medicine from a vial. Alright, so I prepared my medicine outside the patient's room. I've done my 5 writes and my 3 checks, and now I'm getting ready to administer the medicine. So I would do hand hygiene, put on my gloves, I would choose the appropriate site, which is the inside of the forearm, and I would clean in a circular motion, inward to outward. And I would let this dry, and then I would pull the skin taut and inject the needle bevel up underneath that first layer of skin. And then I would inject the medicine, and a wheal should form. Pull it out. And then I would throw my needle away. Take off my gloves, do hand hygiene, make sure the patient is comfortable, and I would document what I just did. And then I would come back and evaluate the patient and see how they reacted to the medicine. So now I am going to do the SubQ injection. Got my needle, my ampule. So I would do my 5 writes, my 3 checks, and I would prepare the medicine outside the patient's room. I've got my ampule. I make sure that all of the medicine is outside of the stem. I'm going to break the ampule away from my body and throw away in the sharps container. Then with my, I'm going to put on, going to do hand hygiene just to make sure. Alright. So, now using my filter needle, I'm going to take the medicine out, not touching the vial, I mean the ampule. I've got the appropriate amount of medicine. I can throw the ampule away and recap my filter needle. Then I'm going to do hand hygiene and put on my gloves. Now I've got my medicine, I've done my 3 checks, my 5 writes. I'm gonna switch over the needles. I'm using a 25 gauge 5/8 inch. I'm gonna make sure all the air is out of the syringe and the appropriate amount of medicine is ready to go. Alright, and then I would clean the site. I'm using the upper arm and let it dry. And then I'm going to pull the skin taut and with a dart-like motion inject the needle at a 45 to 90 degree angle. And then I'm going to insert the medicine 10 seconds per milliliter. And once all the medicine is in, I'm going to throw away my needle in the sharps container. I'm going to take my gloves off, and I'm going to make sure my patient is in a comfortable position, and then I'm going to document what I just did, and then I would come back and evaluate my patient and make sure that she's doing good with the injection I just gave her. And that's all.